In March of 2020, the spread of Covid-19 was declared a global pandemic. And due to the dedication and hard work of researchers around the world, members of the general public were receiving doses of what's called an mRNA vaccine just 9 months later.
One of the really miraculous things that happened in the medical community and the scientific community is that we were able to DNA sequence the virus within 2 weeks. And internationally, that information was shared. Vaccine technology and new vaccines that come on the market go through a pretty rigorous development. And of course, the vaccines are tested in animals before they're tested in humans.
Messenger RNA vaccines are relatively new but have been studied since the 1990s. Here's how it works. The vaccine gives instructions to our immune cells, which then develop a spike protein found on the COVID-19 virus. Our immune system then responds to that spike protein and makes antibodies. Those antibodies then protect against future infection without the risk that comes with catching a live form of the virus.
If you look back at the history of vaccine development, typically if there's going to be a problem with the vaccine, it's identified within the first 45 days of having received the vaccine. And literally there are groups of experts that sit down and review that information for every single vaccine that's on the market every 2 weeks to follow trends. So there's a meticulous process to ensure that side effects are not missed.
Vaccine tested in humans goes through 3 phases. In phase 1, the vaccine is tested on small groups of people. In phase 2, the testing expands to hundreds of people with various dosages being tested for their effectiveness, and people with varying health conditions from various demographics are brought in. In phase 3, thousands of people from broad demographic groups help determine the safety and efficacy of the vaccine. The vaccine was then approved by the FDA for emergency use, and the first official shot was given mid-December. Since then, 158 million Americans have received at least one shot, and 124 million of those people are considered fully vaccinated, as they have received both of their shots.
I recently got my first dose yesterday, and I'm planning on getting my second one on June 7th. And I feel completely fine. My arm's just a little sore, but other than that, I feel fine.
In today's world, there is no shortage of information on the vaccine. The problem is making sure people know what information is backed by science and not by conjecture.
So a lot of the information that's misguided on the internet has to do with that somehow you're changing your genetic code by introducing a piece of genetic material, and that's not true, because it doesn't incorporate itself into your genetic code. The thing that we're frustrated with as physicians and scientists is that when someone hears something on the internet, they automatically send it on to the next person as if it were gospel. And that leads, just to the premise that if you hear something enough, then all of a sudden it takes a life of its own and becomes true.
But in reality, medical professionals across the nation are extremely confident in the vaccine's effectiveness at providing protection, even more so than immunity that comes from natural infection.
The immune response that you get from the vaccine has clearly been demonstrated to be much more robust and longer lasting as a form of protection than getting natural infection. People can still get infected after they've had COVID. The CDC says your protection is probably pretty good for about 3 months, but after that, then you're likely to be susceptible to infection again.
I think it's a really good way to lower the amount of COVID cases in the world, and it's just a good try. Even if it's not completely approved, I think it's still a good thing to try and keep them down instead of doing nothing about it.
About 1 in every 65 reported infections of COVID result in a death. The idea is that while there may be adverse effects from vaccines in a few people per million, the benefits of the vaccines far outweigh any risk.
But the key to the messenger RNA vaccine is that it's ready now, and it's here now, and so it's important not to wait.
For Wray TV, I'm Delaney Warner.